Eric Fishman with EHR TV, and today we have the pleasure of speaking with Thomas Marsh, Product Manager for McKesson Anesthesia Care. And Thomas, thank you for taking the time today to speak with us.
Sure.
McKesson, obviously a tremendous health information technology company, is pervasive throughout the hospital space, and yet McKesson Anesthesia Care is not as well known as one would expect it to be. I understand there's a tremendous number of new facilities that are coming on board. Can you explain the progress over the last 5 years?
Over the last 5 years, we've contracted with about 100 different facilities. We have about a fifth of those implemented so far, and a lot more coming on in the next year. Because we're not associated with anesthesia machines, we don't make the anesthesia machines ourselves, we're a little less known in the industry. People don't necessarily think of us for that, but the hospitals that have our EMRs obviously think of us for that. But we do have a mix of hospitals with different EMR systems that we fit into. We've been highly focused on the anesthesia experience. So it was actually developed by an anesthesiologist, so the workflow is very specific to anesthesia. But yeah, it's been a bit of a challenge to become well known in this industry because, again, we don't have the anesthesia machines and we're just not thought of as an anesthesia company.
And let me address the anesthesiologist, him or herself, for a moment. There's obviously a lot of interested parties in the acquisition of an AIMS product. What do the anesthesiologists who are using your software think of it?
The anesthesiologists that use it like it very much. It's very user-friendly.
What do they see as its strong points? What do they say? What differentiates it from others?
If they're using our surgical products and our clinical products, then the integration is very beneficial to them. They can complete their pre-assessment with clinically collected data on the patient assessment, the allergies, the home medications, all of those things very quickly. Save some time on that, but it also increased the accuracy of it. For the intraoperative record, it's a touchscreen-based application, very fast, very easy to use. We have it even in ambulatory surgery center, where they do 20-plus cases a day in one room. And when they're done with the case, they're finished with their documentation.
As an orthopedic surgeon, I long for turnover times like that.
And we also do that. We have extensive analytics, so we can really delve into what is causing problems with turnover times. We can look at different milestones, in-room to induction, induction to incision, emergence to out-of-room, things like that, so we can really get to the bottom of different situations. So we also have an optional coding module, so they can actually code the ICD-9, the CPT, and also get the anesthesia crosswalk for that as well. So when they're finished with their case, they could actually be done with most of their billing as well. They can document the comorbid conditions. So we've tried to focus on satisfying the anesthesiologist, getting that billing information together, ease of use, speed of use, but also focusing on the hospital administration as well, giving them a reason for it. So those comorbid conditions, they affect the hospital, or they affect that DRG payment. They can make a big difference in the length of stay, very big differentiator for that. Also, sending those administered medications and things back to our core clinical systems, things like that can help with the medical reconciliation and those kinds of things. So there's a lot of interest in it for the hospital as well. So we've really been trying to satisfy both sides.
Let's talk about a third interested party. How does it improve patient care?
We do use First Data Bank, or actually Multum as well, to scan drugs against allergies and existing home medications and other administered medications. So we do provide those alerts. You can also build any other kind of alerts that you want based upon physiologic states or pre-existing conditions, patient weight, and any other drug class and drug-to-drug interactions, things like that. You can build a lot of different checks into it. You can also, if you do have a reaction, we do use the First Data Bank monographs so that you can find out more about that particular drug if you're not familiar with it. We have what we call an academic database. You can actually link to any resource on the net, so you can go out and get information about different protocols and medications and things like that as well.
Clinical decision support.
Yeah, you can link to all of that. And then we also, with our perioperative nursing system, have the handoff of the vital signs. We have preoperative and postoperative. We also have incorporated the SNOMED coding that was developed by the Anesthesia Patient Safety Foundation, so we can go back and look at outcomes that have occurred in each case, look at preoperative case mix, pre-existing conditions, things like that.
So let's discuss the perioperative period for just a moment. Does it connect to the surgeon's office, any of their information systems?
It doesn't connect directly to again, it would depend upon what system they have. They can access certain modules like the pre-assessment piece of it and the post-assessment piece from their offices and review and add information. Depending upon what system they have and what data they could send, it is possible to share some of that data.
But it does.
Just depends.
It would be considered a complete AIMS, and it does all of the hospital-based facilities, the preoperative room, the recovery room, the ICU.
Yes, you can use it in any environment you want. Labor and delivery, endoscopy, whatever any place that you do anesthesia. You could even use it for pain or anything like that. And you can customize your configurations for those locations as well.
And let's discuss the anesthesia machines themselves for a moment. You said that since you don't produce one that it's attached to, that it's compatible with all of them. Is that broad compatibility, so that essentially any anesthesia machine is compatible with
Yeah, we use a third-party vendor for that, for the drivers that connect the systems. Very well known, and actually we have one that we partner with mainly, but we can use others as well. So they do have a complete list of drivers for all these different anesthesia machines. Basically, all of them are covered except the very newest ones. And as newer ones come onto the market, then they do build those drivers, work with those new companies to build those new drivers.
And let's discuss
so
one
it's
more
universal
compatibility, which would be the hospital information systems. There's lots of hospitals that are using McKesson technology, but obviously not all. Is your software, the McKesson Anesthesia Care, appropriate for hospitals that are not using other McKesson products?
Yes, we do have. We currently do have hospitals that are on other clinical systems. We have tried to be both integrated with the McKesson products, but also available for interfacing with external systems as well. So it's more of a matter of what data they will send us or what data they'll accept from us.
How long does an implementation take, generally?
The standard timeline is 6 months. We give you a lot of the pre-configured information, the pre-formatted notes and things like that, and you can edit them as much as you like and customize them as much as you like. So you can spend some extra time or less time, and then you can continue to make changes as you go. So it's very customizable. It's standard to 6 months.
So Thomas, if you could briefly go through the McKesson Anesthesia Care software itself, I would appreciate that.
Okay, we can start with the pre-anesthesia evaluation. Again, if they're using a surgical manager, a lot of this information would be here automatically, but we can receive patient and scheduling information from any system and have that available. We can have lab results come in from any system and have that available as well. And medical history. That can come in from our nursing perioperative system. They can also add information very easily. If they choose to, they can also code these conditions, code them for ICD-9. And
soon ICD-10, I assume?
Yes, will be ICD-10 compliant as well. And at this point, they can screen for any home medications and allergic reactions against the planned medications for this case as well before they finalize the pre-assessment. This final pre-assessment will be sent to their electronic data imaging system or where they like that to go. And they can go back and reference that information or update it at any point in time and even finalize a separate one. So if a resident's doing one and then a physician would come and do another one later, that's possible. The system itself, we collect the information directly from the anesthesia machines. They can add any other information they like, the checklist, whichever checklist are appropriate for their procedure. They can very quickly do this. This module is designed to be used with a touchscreen, so it'll be very fast. They can add any types of notes that they want. Pre-formatted notes is what we call these, so they get different options within them. So very quickly, they can put a very customized note on a case and have all the details covered.
How would an anesthesiologist put in unique data? Is there typing? Is there speech recognition?
Free text typing, and we do provide keypads. On-screen keypads to put any extra data in, and even within the notes there can be options to add free text as well. So these can be single choice, multiple choice, etc. And they can come back at any time and update this information. They can put the correct time on it if they're doing it just after the fact. They can do multiple notes at the same time and really collect any type of data that they want. The actual case data as well as PQRS data and any other kind of codes we can collect, and along with those notes, a block place for post-operative pain will automatically grab that CPT and put it on the record for them. They can trigger timestamps just with the touch of a finger on the screen. They can deliver medications. They can even deliver the full panel of pre-induction medications with the multiple select and enter all of those at once. And again, if they need to retrospectively time this, they can, and we'll carry that timestamp for all of those meds. Any medication alerts will show up automatically for them. They can choose to have the pop-up, which should come up, or they can choose to avoid that and just have it in the banner here so that they never lose the information. All the information is provided in reports, which can be customized to whatever degree they want, and they can pick and choose which reports they want to include in their final record and any information they want to include in their final record. We also have a professional services report where everything is summarized for the professional billing, including any coding that they might have done or included in that. And then they can trigger any particular note to show up in this as well that's relevant to the billing company. They can do inputs, outputs, really anything that they need to document, even an artifact, a reason, an artifact that occurred, and a reason for that artifact at any point in time. Everything is manageable, everything is editable, everything is under their control.
Things certainly have changed in anesthesia records over the last number of years.
Things have been changing very rapidly. It's still a low adoption, but a lot's been changing. The profession is very demanding. They want a system that does a lot of things. So a few of us have been around long enough to be able to do that. But we've really been focusing, like I said, on satisfying the needs of the anesthesiologists, the clinical users, but also the hospital and the facilities. So yeah, it really can chart anything you like. You can do the post-operative review as well. And when you're finished with your case, you can actually be finished with your documentation, send that to your billing company, and
as it should
move on to the next.
Thomas, I think we'll be speaking again, and I thank you very much.
Sure, thank you.
This is Eric Fishman with EHR TV. We've been speaking with Thomas Marsh, Product Manager for McKesson Anesthesia Care. Thank you.